So I'm Michael Vargas, and this is my postpartum assessment. This is my mom playing patient. Uh, so before coming into the room, I'd probably want to look at the patient's chart, see their birth history, if they had a vaginal birth or if it was a C-section. I would also want to see, so that ahead of time I can know if the patient has a history of depression or postpartum depression. And then entering the room, hi, I'm Michael. I'm going to be your student nurse today, and I'm just going to do a really quick postpartum assessment on you. Do you mind if we take your vital signs really fast?
No, it's fine.
Okay, so I would leave the room or leave the area real quick just to go wash my hands, do regular hand hygiene, or put on gloves, take the patient's vitals, and then move on to the postpartum assessment. If the patient wasn't my mom, I would be exposing her breasts to look that if she's a breastfeeding mom, I want to know if there's any kind of attachment issues going on, which would be evident by any scarring or tears, lacerations around the nipple or areola. I would have signs about pain as well, so that we can understand if maybe she's engorged or if there's any kind of risk for mastitis. We would be also assessing if she's not a breastfeeding mom and wants to bottle feed instead. We would try to not touch the breast as much. We would instead encourage her to keep tight-fitting bras on or clothing that is tight-fitting so that they don't have too much stimulation. And then moving on to the uterus examination, I would have my non-dominant hand onto the pubis bone and my dominant hand right above the, or right at the umbilicus, and trying to just see if when I'm massaging the uterus, if I get firmness. If I don't get firmness, I'm not supposed to take my hands off until I get a nice firm uterus. And if for whatever reason the uterus is not midline and it's possibly to the right, that's usually a sign that the bladder is full. So I would ask mom to use the bathroom. And again, yeah, I would keep massaging that uterus, just make sure it's nice and firm, being able to measure, depending on what days it is after the birth, it's going to be about 1 finger width difference for each day after birth underneath the belly button. Then moving on to for bladder and bowel. Are you going to the bathroom normally? You're able to pee? You're not feeling like you're retaining any pee when you go to the bathroom?
Nope, everything's good.
Okay, and then have you been able to pass gas? Have you been able to have like a bowel movement?
Yes.
Okay. Then I would go ahead and take a look inside the patient's underwear linings, comfortable as they were with me doing so, where I would see their lochia. Hopefully they had a nice fresh pad last time. And I'd be looking for, if it's early on, signs of the lochia rubra, which would be much more red, possibly blood clots, and be much more substantial bleeding of the lochia discharge. And then if it's been a couple of days, I'd be seeing more lochia serous, whereas lochia alba would be once they are probably discharged. I would also want to take a look at the patient's perineum. Even if they didn't have an episiotomy, I'd want to make sure that there were no lacerations from the vaginal birth process. And next, I would also want to look for like swelling in the legs, heat in the legs. I would ask the patient if have you had any pain in your legs lately, either side?
No.
No? Just looking for signs of blood clots that could have formed in legs. And that would have also been with a head to toe assessment as well. The last thing I would want to ask, or I would want to note about, is if I've seen mom regularly feeding or regularly interacting with baby, if she's shown me any signs of depression, especially postpartum depression, especially if she has a history, just seeing her attachment style with baby and noting that, and if we needed to intervene or anything such as that. But other than that, then I would, of course, secure the patient, make sure that they're nice and safe as well, with the rails up and that they're comfortable, don't need to use the bathroom or anything like that. And I'd say again, like, thank you for letting me do this. Is there anything I can bring you?
No, thank you.
Okay, and then I would leave the room or go out to the sink and I would perform hand hygiene and be on with my day.